Today, you'll see What's Cooking, the inaugural episode of the Project Open Hand series on the important work of meeting the nutritional needs of the community. We'll meet the leadership that makes it happen, and of course, what's on the stove. Hi, I'm Umar Santiago, and I'm the Vice President for Development and Community Affairs at Project Open Hand. And with me today is our top guy, our CEO, Paul Hepfer. Paul has had an amazing career with his education and background in recreation and health, and he's impacted the lives of thousands of clients in the organizations that he's led. We've been invited into Paul's Kitchen here in San Francisco, just across from Mission Dolores Park. Paul, thanks for inviting us into your home and being the first in the series.
Thanks for coming.
So let's start with a question about what Project Open Hand does, particularly MTMs, medically tailored meals. What does that mean to be an MTM provider?
Medically tailored meals are really just that. They are meals that have been designed around someone's particular health need. Versus another meal that just may or may not be healthy or nutritious. Medically tailored meals, the menus have been adjusted. In some cases, for someone with heart disease, the sodium has been virtually removed or very, very low. But then the added point that we really emphasize to really make it medically tailored is that we have a team of health providers like registered dietitians that work with our clients to make sure that the menu and that the meal itself is meeting the needs of the client.
So Project Open Hand has been around for decades. Can you tell us a little bit about the beginnings and how it came to be what it is today?
Our founder, Ruth Brinker, pretty well-known name throughout San Francisco and the Bay Area, founded our organization in response to her recognizing a tremendous need for young men that were dying of HIV and AIDS. She knew that no one should suffer and die alone and be ill without the nutrition they needed. So she began producing meals out of her own kitchen, taking them to people that needed it. And fast forward 35 years later, we now do over 1 million meals a year and serve thousands of people.
Very impressive. And so how big is the organization now?
We have about 130 full-time employees. In a non-COVID pandemic year, we have nearly 9,000 volunteers a year. Dozens and dozens of corporations help out at Project Open Hand. And like I said, we provide meals throughout San Francisco, Alameda County, Contra Costa County, in some cases northern San Mateo County, and we have partners in Santa Clara County too.
So how does a client, a patient, how do they get involved? How do they access the service?
Yeah, so our service, as we described, the medically tailored meal is a unique type of service. It is different from a basic, from a food bank or a pantry program or a community kitchen that provides meals to people on a daily basis. All of our clients that come into our service receive a referral from a medical provider, a physician, a nurse, a caseworker, actually send a referral to us and we do an assessment to find out what's the right type of meal for that individual. And then we do have thousands of clients at senior centers throughout San Francisco that have access to our meals when the senior centers are open. During the COVID pandemic, we provide take-home meals, frozen take-home meals for those clients. Yeah, it's really any chronic health condition that particularly responds well to a medically tailored meal diet. So that would be clearly HIV. That's where we started in the beginning. Congestive heart failure, heart disease, diabetes, of course, cancer, various cancers, end-stage renal disease, COPD, and a few other ones.
Great. How does a nonprofit organization like this actually have the resources to produce 1 million meals a year? Where does that money come from?
We really have a fairly diverse portfolio of funding sources. Our bread and butter over the years has really been private philanthropy, fundraising. Tens of thousands of people every year donate any amount of money from $1 to thousands and tens of thousands of dollars. Over nearly 50% of our revenue still comes from fundraising. We do what we can to try and secure government grants and contracts. Like I mentioned in the senior meal sites, over 16 senior meal centers in San Francisco is largely supported by the city of San Francisco. And in more recent years, healthcare payers, insurance companies have started to recognize the value of a medically tailored meal service, and they know that if they add this as a covered benefit, not only are their covered members, their patients, likely to get healthier and maintain their health, but they also reduce healthcare costs.
That's amazing. And I know we've helped so many people over the years, and we meet them, and sometimes they just get better and they don't even need our service anymore.
That's the goal, really,
Yeah.
and help people get to the point where they can cook the healthy meal for themselves that's most important for them to self-manage their health condition.
Great. What are you cooking for us?
So when you asked me to that I was going to be in episode number 1, you said, "What do you want to cook?" And immediately I thought, well, I definitely want to make something that I can use items that I grew in my garden myself. So that kind of narrowed it down a little bit to one of my dishes that's really involved is tomato sauce. I love making tomato sauce with my heirloom tomatoes. And usually I have about 5 or 6 different varieties of heirloom tomatoes, and I mix them all together and make a really, really great tomato sauce. But it's not tomato season, so I don't have any right now. So the other dish that came to mind was calabacillas.
So calabacillas.
Yes.
How translate that?
Okay. Literally, the translation is little squash.
Oh, okay. How did this come to be your favorite dish, or one of your favorite dishes?
Yeah, well, it's definitely not something I grew up with in southern Indiana. We didn't make a lot of calabacillas with green chili. We did eat a lot of summer squash, and I've been gardening my whole life, ever since I was a kid. And zucchini and yellow squash was one of the most prolific items that you could grow. And so we did have a lot of dishes that had squash in it. But calabacillas, I learned from my time when I was living in New Mexico, particularly working for the community, the Pueblo of Sandia, outside of Albuquerque. And on feast days, on June 13th, families and communities would come together during feast day and invite people over for a meal. And one of the items that was at virtually every house was calabacillas. And a lot of different families made it differently. My understanding that it is a traditional Pueblo Indian dish that they taught the Spanish how to make in the 16th century. People have different variations on it, but generally it definitely includes squash and corn, and if you're in New Mexico, it has to include green chilies, which is my favorite part of it.
Great. Well, let's see you put it together.
In my particular dish, we have I add ground beef to it. A lot of people don't put meat in it. You can easily make it vegetarian. And it's also a dish you could really make very low sodium too. So I'm finishing browning the meat here, so I'll just give that a quick stir here, and then we'll get the rest of the squash ready. Green chilies are definitely one of my favorite foods. This is, most people call it Hatch green chili. It's not always grown in Hatch, New Mexico, which is southern New Mexico. Sandia grows a lot of chili. All over the state of New Mexico, they grow the chili. But this is the roasted chili. After it's roasted, you can see the peel is roasted. So after you roast it, you take the peeling off and you chop it up, and that's the part we'll use today too. So I'm going to keep putting squash in now that the meat's brown. I'll cut some more squash up.
So, if you don't mind talking while you chop, we want to talk about leadership. And you have come to this role of CEO, and obviously you've been in charge of many, many things over your career. How would you compare being the CEO of Project Open Hand to other leadership?
Throughout my early days and finishing grad school, I was involved in experiential education and outdoor education, and one of the topics that was a theme for everything that I was taught and people that mentored me was servant leadership. And I think that actually even comes out in how I was raised, possibly, that you lead by serving other people. But my parents taught me when there's someone who really needs your service in the community, that's what you do. And it didn't come from a point of this is the government doing it for you. To my parents, it was really important that you really help people out.
Yeah. So it sounds like caring. It sounds like loving, it sounds like community, all of those things. So that's an element probably that gets its focus in your leadership as well. But when it comes to nonprofit leadership, go ahead.
Yeah, no, that's all right.
I need the garlic. When it comes to nonprofit leadership, what do you think Because there are millions of nonprofit organizations in our country,
Yeah.
all trying to do good for their community, right,
Right.
and their interests. So what would you say are elements of success in a nonprofit organization among its leadership? What does that mean?
Yeah, I think you really have to be grounded in your mission first and foremost. You really have to understand why the nonprofit is there, that particular entity is there to begin with. Because if you're not constantly grounded to that why exists, why go through all the effort of fundraising and doing things like that if you're really not 100% grounded in your mission? But then I think you really have to be a savvy business person. You really have to understand funding makeup, how to respond quickly. I'm trying not to use the word pivot because I think it's the most overused word this last couple of years.
Yeah.
But you really have to be able to transition and move to different directions based on the climate and the trends of the community. And I think those points are really some of the most important aspects.
Well, so how did that demonstrate itself during this really, really scary time of COVID? I mean, right now, San Francisco and a lot of California and the nation is going maskless after 2 years of, oftentimes living in fear and concern and many, many people dying. And it's still a concern. But what did it mean for Project Open Hand to be a nutrition provider during this time?
So, we were immediately recognized as an essential business. When the shelter in place first happened, actually we're coming up on the anniversary, March 17th, March 18th, I believe, 2020. We all rallied together and said, look, we're an essential business, we're going to keep doing this. And we had to use the information we had. Like, at the time, you probably remember we were all wearing gloves. You couldn't take a shopping bag into a place because we thought that the shopping bag would spread COVID. But we just had to be responsive and pay attention to the facts that we did have and keep all of our clients safe first and foremost, and just adjust based on what we knew at the time. One of the big adjustments we did make was, for the home delivered meals that we provide, a lot of time they're frozen meals and they're 7-packs. Normally we would visit someone, knock on the door, and the person making the delivery would say hi to the client and visit for a bit. But so we developed a simple technique of what we call knock and drop. And so we take the 7-pack of meals, we hang it on the doorknob, knock. Our delivery person would step away more than 6 feet, because that's what we were told, and make sure the client came to the door and wave at the person and make sure, that was the most socialization we could do at that point. But that's one way to help make sure that we kept our staff and our clients safe too.
Yeah, I remember you and I actually made some of those deliveries.
We did.
Some folks were really concerned about having to have any contact with anybody on the outside. And
Yeah.
obviously that could, I imagine for elderly or disabled living alone, that time was a very, very lonely period.
Yeah, and another thing that we had to do, we went from about 2,500 frozen meals a day, 2,500 frozen meals a day, and because we couldn't provide the hot meals at the senior sites anymore, so we shifted those hot meals to frozen meals. So we nearly doubled our production of frozen meals at the highest peak of COVID. And where do you put all these meals? So we didn't have enough room to put the frozen meals, but we were also really aware that we needed to have our own continuity of operation if we had kitchen staff that got COVID, and if our production was cut in half and we didn't have a backup supply of meals, then that meant someone wasn't going to get food. So we procured a freezer trailer, and the city helped us install it. It's parked on Ellis Street right now. It's hard, you can't miss it. And we had it hardwired in, and our electric bill doubled during COVID just to keep it frozen. But we got to the point where we could have 5 to 6 weeks ahead of frozen meals, so that we had a buffer in case we needed it during that time period.
Your cooking's coming along. I see you've added corn. So
I have.
It's not just like frozen corn. You cut that stuff right off the cob.
I did. Well, one thing, being from Indiana, I know corn pretty well. I didn't grow this corn. I don't grow corn in my garden. I just don't have enough space for it, and I can get it cheaper, you know, at a nice farm stand somewhere. And I really, most of my garden space is tomatoes, peppers, and squash and things like that. Can't grow green chili here either. In New Mexico, green chili really only grows in New Mexico. I've tried it here in California, it just doesn't work.
So
That's a lot of green chili.
So is this from what source?
Well, I don't want to tell you my source.
Oh, okay. Top
Now,
secret, everybody.
there are a couple markets in the Bay Area that now carry hatch green chili,
I see.
but only once a year, and it's usually in September. And they sell out pretty quickly. I put my name in, and I think I got 40 pounds this year.
Reservations.
That's right. Yeah, 40 pounds. Then I bring it home. I usually peel it and chop it, but I keep a few that aren't peeled either, just if I didn't get around to chopping all of it.
So you actually roast these yourself then?
No, I didn't.
Oh, I'm
Yeah,
sorry, I missed that.
the grocery store has they have a giant propane roaster.
got
It's
it.
a hopper. You put the bags in, and they have the torch on it that roasts, and then you take it in. Then you take it home and bag it up.
Okay. So far I've seen onion, corn, squash, bell pepper.
Yep.
Did I miss anything?
You did not.
So you have spices here too.
I did.
Um,
Yep. This is cumin, so I'm going to add cumin in a minute, and cayenne pepper because I always like more pepper and black pepper. I'm not going to add salt. You know, one thing that I try and challenge myself on my own diet, I know I have too much salt in my food. I eat out a lot, and I've really tried to cut back in sodium. So when I make something like this, it's going to taste great without salt. I'll use some chicken broth that already has a little bit of sodium in it too. So, but really with the flavor of the New Mexico green chili is just amazing by itself.
And it looks like you have ground black pepper.
I do. Yep.
All right.
Yeah.
Great. Oh, I didn't get to ask. Is the hatch chili hot? Is it a hot pepper?
So you can order it. They grow different fields will grow different heat levels. So you can get mild, medium, hot, and even extra hot.
But they're still all the same.
The same pepper. Yeah.
Okay.
The ones I got are hot. So when we taste it here a little bit, you will see
Yes.
that it is hot. I love spicy food, and that's probably what I miss most about New Mexico is the spicy food there. But when I can get my own supply of hatch chili, I feel good about that.
Great. Well, let's talk a little bit about, while things are simmering
yeah.
and cooking, let's talk a little bit about the future for Project Open Hand. Things are opening up. We'll be able to serve seniors in congregate settings. But longer range for the organization, what do you see in its future?
Yeah, you know, I think we learned, so as a nation, I think we all learned a lot during COVID about what a fine line we have as far as the basic needs for many of our community members, particularly our adults that are older and that are dealing with chronic health conditions and of diverse populations. It showed us that there's a very fine line between being food secure, nutritionally secure, and not having what you need to live. I mean, to really live. And I think that as a society, we need to really look at that now and how can we ensure that it doesn't take something like a pandemic for us to realize how we just aren't taking care of our community members like we should be. So I think that from a global level, I think we're going to continue to call attention to that, to our community, so people understand that. But then also, we're doing a lot to research and evaluate the effects of our medically tailored meals on people that have various chronic health conditions. We've had a lot of great research already that shows reduced hospitalizations, reduced readmissions, reduced incidence of people developing secondary chronic diseases. We know people with type 2 diabetes have a higher likelihood of developing heart disease. But if we help them maintain their diabetes, maybe they could prevent heart disease later in life too. So I think we really need to focus on continuing to build that body of research and sharing it with the medical providers.
So there are efforts underway at a national level as well. So Congressman Jim McGovern, who chairs the Rules Committee, has really made this a focal point for legislation and advocacy. And can you tell us a little bit about the national effort and movement?
Yeah, he's been a great champion of ours, and so has Speaker Nancy Pelosi in our district, and Congresswoman Barbara Lee in the East Bay. We serve both of their constituency, and this medically tailored meal bill will mandate the Centers for Medicare Services to conduct at least a 10-state, it might be more states than that, pilot on the effects of medically tailored meals for people with certain health conditions. And the reason to do such a large research study is that if we can continue to build the data, we can show health payers, including Medicare, that this is not only the right thing to do, but also something that will really help reduce healthcare costs for all of us. You know, so if we can reduce unnecessary hospitalizations and prevent other chronic health conditions, we can save tens of millions of dollars as taxpayers too.
Yeah, I think it would be even more than that, because, you know, what's it cost for a hospital stay, you know, depending on the condition, tens of thousands of dollars in some instances if it's a very serious illness.
That's right.
And that could lead to death.
I am adding a little bit of chicken broth. Some people don't. I just like it a little saucier, you know. So I added chicken broth, and I'm going to put my spices in now. I know some of the chefs that we've worked with at Project Open Hand. When I watch their cooking shows, they add their spices later on in the dishes, you know. So my whole life always added it early, and I understand that you can cook some of it out unintentionally.
Oh, right. Wow, I
You didn't know that?
I still do it early.
Okay.
To make it blend. All right, great. So this is awesome, and I have to tell you, because I know that you can't do this, but the smell is filling the room, and I am quite hungry right now. So we're looking forward to tasting it.
Yeah, I'm going to let it cook for about 20 minutes to
Okay.
let the squash soften up and cook together and really get the flavor of the green chilies infused, and then we'll be ready to try it.
Great. So this is our first show in this series, and I want to ask guests who are, you know, obviously from our organization, 3 questions. So let me ask you 3 questions. What advice do you have for those wanting to be leaders in the nonprofit sector?
Be really passionate about why you want to do it, and committed to the mission.
It's not a job, I guess.
There's a lot of other things you can do with that are possibly less physically, emotionally, and psychologically challenging.
Absolutely. Great. If you could change anything about the nonprofit sector, millions of organizations, regulations, operations, or correct any misunderstandings, what would that be?
You know, that I'm glad you asked me that now instead of a few months ago, because I just kind of formulated something that has really frustrated me over the years in the nonprofit world, and that's that most people know we always operate on a shoestring budget. You know, we're at the mercy of our donors and our government contracts, and we invest so little in innovation in general. You know, particularly here in the Bay Area, most people that work for a corporation or in tech, there's always an R&D phase, you know, and there's money invested in that, and that's how you get the next product. That's how you get to that. We almost never do that in the nonprofit sector. And we're trying to do that at Project Open Hand, where we know that we need to continue to innovate and improve the quality of our meal itself, because it has to taste good, which ours do, but we also know that we have a lot of competition out there with less healthy food. And so we want our clients to want a healthy food. And unless you kind of carve out time and resources to innovate, how do you package it differently? What variety of spices can you use? So that would probably be my biggest pet peeve about nonprofit sector in general. We don't invest enough resources into continuing to innovate our products and services.
Great. I have one last question.
Sure.
So we do meals. It's for
we do.
health. It's meals with love. And meals that heal. So what is one thing a viewer or listener can do related to diet that will improve their health? Do you have a tip?
I do. Cook more. Cook more of your own food if you can, if you have the ability. You know, I'm guilty as everyone else about overindulging at times in processed food, and I have my occasionally, you know, I'll drive through a fast food place now and then too. But I really try and limit that and try and spend more time in your kitchen. Another tip: if you do have the ability and space and geography, growing your food too. I do find that the more time I spend in my garden growing food, the more likely I am to eat that type of food too.
Great.
In fact, in my office right now on Polk Street, I started my tomatoes really early. It's March right now, and my tomatoes are like this tall, which is too early to put them out here. But I'm ready to go. I'm ready to get out there with them.
Your heirloom.
Heirloom tomatoes, yeah.
Very good, very good. All right, Paul, thank you for inviting us into your home, for preparing this dish. We're going to taste this a little bit later, so we're going to break while everything simmers.
Okay.
And then we'll come back and taste.
Excellent. Thanks. All right, well, I think we're done. Let's move it over here and take a look.
Oh my gosh, that looks so great. Look at that color and that smell.
And you can smell the chili, can't you?
Uh-huh.
All right, well, we'll dish some up for everybody. I'll get a little chili steaming on my face while we're doing this. 4 of us here, so I'll get some.
Oh, we're feeding the crew too.
We are. We're the crew's eating today too. Yeah. And you know, whatever I have left over, I'll probably eat more tonight or tomorrow, and then it freezes well and reheats really well too. And you know, a lot of people, when you actually look up this recipe, a lot of people put cheese in it. Some people will even put cream or milk just to make it a little creamier. I put cheese on so much other stuff, I actually like to not have cheese on something and try and keep this a little healthier.
Yeah, it smells great. It's so fresh. All the vegetables, man.
Go, yeah, please do. Bon appetit.
Bon appetit. I'm gonna taste.
Okay.
Mm. Oh my gosh, that's so amazing. I can taste the spice.
Yeah.
The heat. It's great.
Very good. Mm.
Well, thank you, Paul. Thank you for inviting us into your home,
Mm-hmm.
making this lovely dish that I'm going to finish real soon. And thank you for your leadership. You know, as CEO of Project Open Hand, it's an amazing organization. I've been privileged to be a part of it, and there's a lot ahead in the future to serving many, many more people. Hopefully the movement of food is medicine is going to sweep the country, and everybody's health will be better.
Well, thank you. Thanks for coming.
Thank you.
Thank you.
I hope you've enjoyed our first show in this series, What's Cooking? Please be sure to subscribe and you'll get alerts to our next episode. If you'd like, please join our mailing list. And if you're in San Francisco or the Bay Area, you can go to our website and sign up to volunteer. We'd like to hear how you found the show today and any feedback you might have. On behalf of Paul and the video team here, we'd like to thank you for joining us.